Physiowebseries Shoulder Complex Season 2, Series 5. In Series 5, we will discuss about scapulohumeral muscles. So as the name suggests, those muscles will connect the scapula to the humerus. So the scapulohumeral muscles include rotator cuff, which we already discussed in previous series. Other than rotator cuff, it includes teres major, coracobrachialis and deltoid. We will discuss three of these muscles, teres major, coracobrachialis and deltoid, in this series. Let's start with teres major. So it originates from, as we can see, this is the posterior view of shoulder joint. So the teres major arises from this dorsal surface of scapula over here, the lateral border of the scapula and the inferior angle of scapula. So lower 1/3 of dorsal surface of lateral border of and inferior angle of scapula will be the origin of teres major, can be appreciated over here, and it goes to insert on the humerus, to insert on the medial lip of bicipital groove of humerus. So it goes from dorsal side, posterior side to anteriorly at the bicipital groove of humerus. So from back to the front side. Nerve supply to this is lower subscapular nerve, can be appreciated over here. This is the muscle belly and lower subscapular nerve over here. So the lower subscapular nerve innervates teres major, having nerve root C5, C6 coming from posterior cord of brachial plexus. So we got to know the origin and insertion from dorsal surface, lateral border and inferior angle of scapula to the bicipital groove of humerus. That too, medial lip of bicipital groove of humerus is occupied by teres major, and the lateral lip will be occupied by pectoralis major. So lady between two major is the muscle latissimus dorsi, in between those two muscles. Now let's see about the action of teres major. So as we know the orientation, now this first one, superior one, is the anterior view and this below is the posterior view. So in this we can see from the posterior surface it is coming to insert to the anterior side of the body, that is from dorsal surface of scapula, lateral border inferior angle to the medial lip of bicipital groove over here. Same way this in the posterior view we can appreciate the origin as well as insertion. So it goes this way. So it will pull the bone this way. This muscle will exert pull in this manner, which will cause shoulder adduction. So this will, teres major will perform shoulder adduction, as well as we know that it goes from posterior to anterior aspect of the body. So it will help in extension, pulling this way backwards, as well as according to this orientation of fibers, we can think it will pull it this way to perform medial rotation. So it will cause extension, adduction, as well as medial rotation of shoulder. That was about teres major. Now coming to coracobrachialis muscle, which arises with the short head of biceps brachii. So the origin is from the tip of the coracoid process, can be appreciated over here in this diagram, tip of the coracoid process of scapula. So the origin is from scapula, specifically tip of coracoid process, and it also inserts to the humerus. So it inserts to the middle 5 centimeter of medial border of humerus to the anteromedial side. So coming from tip of coracoid process to the medial border of humerus, in the middle part of humerus or middle shaft. Now coming to the nerve supply. So it is musculocutaneous nerve innervating this muscle coracobrachialis, nerve root C5 to C7, and this comes from anterior division of upper and middle trunk. So can be appreciated over here. This is the coracobrachialis muscle over here, and from the anterior division of upper and middle trunk we have this musculocutaneous nerve arising and innervating this coracobrachialis muscle. This one innervating this, going this way to continue. So the musculocutaneous nerve will innervate coracobrachialis. This was about origin, insertion and nerve supply of coracobrachialis. Now what is the action of coracobrachialis? So it comes from the coracoid process, which is slightly, the tip is, we know that it faces anteriorly, and from there it inserts to the medial aspect or medial border of the humerus on the middle part or middle shaft of the humerus. So it causes shoulder flexion. Action of coracobrachialis is shoulder flexion. And what will happen, as we know, the muscle fibers orientation now is in this manner. So if there is hypertonic coracobrachialis, the tone of coracobrachialis is increased, it is in contracted state for a longer period of time, or the tightness of this muscle. So this hypertonicity will result in anterior tilting of scapula. As we know, the orientation is this way. So if this muscle is tight, it will pull the scapula in front this way, causing from its upper side, as where the coracoid process is present. So it will result in anterior tilting of scapula, causing forward rounded shoulders. So that is a short clinical aspect to it to remember. Tightened or tightness of coracobrachialis or hypertonic coracobrachialis majorly will cause anterior tilting of scapula and forward rounded shoulders because of that. So the action we saw of coracobrachialis is shoulder flexion. So in series 5 we discussed about teres major and coracobrachialis, which are scapulohumeral muscles. Deltoid will be discussed in series 6, the upcoming series. Present series 5 consists teres major and coracobrachialis.